This patient, we'll just call him Mr. Jones, right? So Mr. Jones would come to see me for his diabetes. He was very overweight, works a stressful job, manages some restaurants. You know, his eating schedule is not a healthy one. He gets home late at night and then eats whatever he can. So I struggled for a long time with him trying to get his diabetes under control, and he started to develop neuropathy, which is where your feet are very painful and they burn at night, and he was developing some other complications of diabetes. Of course, here we have all these wonderful resources that you really don't have access to in private practice, like a health coach.
My job is just kind of meet the patient where you are. One of my jobs as a health coach is to give you the tools, give you the skill set, give you the ideas to be able to go out into the world and make your own decisions. I can't go to the grocery store with you. The doctor can't go make you exercise. At some point you have to find that motivation within, and sometimes it happens in a couple of weeks, sometimes it happens in a couple of months, sometimes it takes 2 to 3 or 4 years for that to happen. Each person is individual on their journey, and my job is just to kind of meet them where he is.
Over time, he met with her several times. The other thing that happened with Mr. Jones is that diabetes medicines, some of them are brand name and they're very expensive, like hundreds of dollars for a month's supply. We have a patient assistance program where we have several people on staff whose only job is to help patients get these expensive brand name medicines. So Mr. Jones was able to get on a couple of newer diabetes medicines and meet with the health coach. After working with the health coach, and it took a couple of years, but after working with her and getting these medicines and continuing to come to see me, his A1C now is below 7, which is amazing. And the other miracle part of it is that his neuropathy is resolved. In other words, he doesn't have pain in his feet anymore. And I just saw him last week and I said, so aren't you taking that medicine for the pain in your feet anymore? So no, that went away.